Good afternoon, everyone. Welcome back to our live session on Cancer Reach. Cancer Reach is initiated by Dr. Krishnamani to spread awareness about the cancer and help the caregivers and patient to access the right treatment on right time. Thank you once again for joining us today. In our previous 2 weeks back session, we had an opportunity to learn what exactly is a lung cancer and what are the major things which we can avoid lung cancer from our expert Dr. Krishnamani. And as promised, today we will have more understanding on how to approach stage 4 lung cancer from none other but our cancer guru Dr. Krishnamani in the support to Lung Cancer Awareness Month, which is in November itself. So, Dr. Krishnamani has more than 11 years of experience in the field of oncology for treating different types of cancer and expert, especially in treating lung cancer. Dr. Krishnamani is associated with American Oncology Institute of Hyderabad. So, without any further delay, let's welcome Dr. Krishnamani to this live session on Cancer Reach. Good afternoon, Doctor.
Good afternoon. Welcome all to Cancer Reach. Cancer Reach is an initiative to spread awareness about cancer. And today we are discussing a very important topic, something which has revolutionized our treatment in the last 10 years. So, stage 4 lung cancer, in the last 15 years or so, there's a remarkable change. So, what was written in textbooks 10, 15 years back, what was practiced, that has changed. And patients' lives, you won't believe, has become really, really better. So that is what we want to discuss today, and how these innovations have impacted patient care.
So thank you, Doctor. Doctor, before we jump in understanding what exactly is stage 4 lung cancer, can you just brief for our understanding that what exactly is a lung cancer? Just a small brief on it.
So to give you a background, lung cancer is one of the commonest cancers in India today. Cigarette smoking is a very important reason. Other reasons are people who have occupational exposure like asbestos. Okay. Passive smoking, somebody who smokes a lot at home, and if I am a non-smoker and if I inhale, I have a risk of lung cancer. But today, almost 40 to 50% of lung cancer patients are never smokers. So even non-smokers get lung cancer. Understand that. Don't think that you're a non-smoker, you will not get. But if you're a cigarette smoker, stop. Then the symptoms, just to give you a brief, lung cancer patients can present with chest pain. They can present with cough. They can present with bleeding in the sputum, in the cough. They can present with breathing difficulty. They would say, when I walk now, I am having breathlessness. Earlier, I used to walk 2 floors or 3 floors. Now, when I walk on level ground, I'm feeling breathless. Then, if the disease is advanced, if it spreads to the brain, they can get seizures, headache. If it goes to the spinal cord, they can develop severe bone pains. So these are all the ways in which lung cancer presents. And please note, even today, close to 70-80% of lung cancers are in the 3rd or the 4th stage.
Yes.
By the time we detect the lung cancer, it is in the 3rd or the 4th stage. And how do you diagnose? You diagnose it, as we always say, one with a biopsy, and then we do scans like PET-CT or CT scan. And when it has spread to other organs, it is called stage 4. So stage 4 means, or advanced lung cancer means, the disease has spread to the brain or the bone, liver, opposite lung, okay, or areas which are distant to some lymph nodes, which are not in the draining area. So this is advanced lung cancer. So that is what we are going to discuss today.
Yeah. Thank you, Doctor. Doctor, like when you are claiming as a stage 4 an advanced cancer, is it something like a stage 4 lung cancer is a death sentence kind of a thing?
So stage 4 today is definitely not a death sentence. Okay, I'll just give you an example. So today, so basically this week we had a patient. He had come to me 3 weeks back. He's a never smoker. He just walks into my OPD. He had some vague chest complaints, went to the doctor, they did CT scan that picked up a lung mass. Now it is stage 4. He is asymptomatic. When you look at him, he is probably fitter than you and me also. But unfortunately, he has stage 4 lung cancer.
Okay.
We waited for 2-3 weeks for certain tests. I'll talk about it. And today we are starting the treatment. So what I'm saying is, if it was a death sentence, that day itself I would have started. Today, certain lung cancers which are called driver mutation positive lung cancers.
Okay.
Driver mutation means there is a mutation which drives the tumor.
Hmm.
Driver mutation. Those patients, that is good if you have a driver mutation, and those patients are put on tablets which are called
Okay.
TKI, tyrosine kinase inhibitors. We have discussed this before.
Yes, yes,
They
doctor.
do much better, and average survivals are crossing 4 years, 5 years, 6 years also now, with excellent quality of life. So they are not living on the bed 24/7. They are working. They are going to office. They are doing their daily course. They are driving. They are
Oh.
popping a pill. They do scans every 4 or 6 months. If
Hmm.
the disease is stable, they continue the same drug. So
Okay.
it has become like a diabetes or a hypertension, a chronic
Yes.
disease, where they continue a medication to keep it under control and keep doing scans.
Okay.
So it is no more a death sentence for everybody. Yes, like every disease or every cancer, there is a small proportion which comes in a very advanced stage where you can't do much. It's like diabetes also. Like some diabetes patient may come with
Yes.
700, 800 sugars. He may lose his eyes, he may lose his kidneys because of that. He's
Yes.
put on
Yes.
dialysis. But does it mean
Yes.
all diabetes patients go on dialysis?
Hmm.
So,
No.
stage 4 lung cancer, no more a death sentence. There is a hope, and driver mutation testing should be done. I'm emphasizing it again and again. Driver mutation testing must be done on the tumor
Hmm.
which is taken. That report takes 2-3 weeks to come. If you are driver mutation positive, it is an excellent news for you. You are put on tablets. You can avoid chemotherapy at least now. And you're scanned every 4 to 6 months, and you generally are continued on the same medicine till you are doing well.
Oh. So, doctor, this technology, we can claim with this newer technology, stage 4 is not a death sentence.
No more.
Okay. So, doctor, like for as you are claiming that for some patients it can be a death sentence. Can you give
Somebody
example like
who ignore the disease, who don't know, who
advanced?
don't show it up, when the disease is spread to multiple areas too quickly, then
Hmm.
see, not much you can do. So that patient is
Yes.
anyway going to be sick. But otherwise, you can still do a lot in stage 4 lung cancer patients.
So, doctor, like while discussing, do all the patient get similar kind of a treatment, or the treatment will vary or differ from patient to patient?
So when you talk about stage 4 lung cancer,
Hmm.
you will do a biopsy. On the
Yes.
biopsy, you get two types:
Hmm.
small cell lung cancer, non-small cell lung cancer.
Okay.
Common is non-small cell. 90% of the patients are non-small cell. So let us talk about non-small cell stage 4.
Hmm.
In that, you have certain types: adenocarcinoma, squamous carcinoma.
Okay.
So today, when you have a stage 4 non-small cell lung cancer, you will do on the tumor certain test called immunohistochemistry to say whether it is squamous or adeno.
Okay.
And after that, you have to do molecular analysis, which is check for
Okay.
driver mutations.
Okay.
You check for some common mutations like EGFR, ALK-ALK, ROS
Okay.
ROS, RET
Okay.
RET, MET MET. So we check for these common mutations on the tumor. It takes 10 days to 15 days to come.
Okay.
If you are EGFR positive, you are put on one tablet called osimertinib or
Hmm.
erlotinib.
Hmm.
Another fellow may be ALK positive. He's put
Okay.
on a drug by name alectinib.
Electin.
Another
Okay.
fellow may be ROS positive. Now we have a ROS patient. For the last 6 years, he's on crizotinib, doing extremely well.
Oh.
Last week, he
Okay.
had his PET CT, completely stable, doing all activities, married off his daughter, playing with his grandson.
Oh.
See, these are
Wow.
all the things
Hmm.
what we want, right? So
Yes.
your quality of life is not impaired. You're just taking a pill and your stage 4 cancer is under control.
Hmm.
So, to your question, whether everybody requires a different treatment, yes. EGFR guy will get a different tablet, ALK will get a different tablet, ROS will get a different tablet. PDL1, if it is high, you get immunotherapy.
Hmm.
If you are all negative, driver
Hmm.
mutation negative, you get chemotherapy.
Okay.
So the three types of treatment are chemo, immuno,
And
and
no.
tablets, TKI, and in some patients, targeted therapy. So if I'm driver mutation positive, I get TKI, that is tablets, based on what it is, EGFR, ALK, ROS, MET, right? If I'm PDL1 high, I get immunotherapy. If I'm all negative, I get chemotherapy.
Chemotherapy.
So every patient gets a different treatment.
So
The
I.
chance, the chance of this driver mutation coming positive is higher in a never smoker. A
Oh, okay.
a man or a woman who has never smoked, you can
Hmm.
tell them, boss, you have a high chance of this test coming positive. But a
Hmm.
chronic smoker, you will tell him, I'm sending your tumor for driver mutation analysis, but high chance it will come negative because you have smoked a lot.
Wow. So, doctor, this newer technology has given a specific treatment to a specific.
Correct. So you give chemo, what will happen? I will lose my hair, I will lose my taste, I'll get weak, skin
Yes.
becomes
Yeah.
dark, WBC falls, hemoglobin falls, platelet falls, I become very weak.
Hmm.
These tablets, EGFR, it acts on the receptor, that's all. No hair fall, no loss of appetite, nothing. You will get
Okay.
some acne over the face sometimes, you may have some diarrhea.
Hmm.
So very, very bearable side effects.
Hmm.
So none of the regular chemotherapy side effects because it is not generalized treatment. It's a very specific targeted treatment directed at that mutation.
Okay. So, doctor, like in this in our discussion, now you were highlighting some of the tests. Can you again, once again, brief what are tests are done on the tumor, just for our
First, you do
customer?
a biopsy, say you have
Okay.
cancer. On
Hmm.
the cancer, you do IHC, saying
Hmm.
that it is small cell,
Hmm.
non-small cell, in non-small cell, squamous, adeno, large cell.
Okay.
Then send this tumor for molecular testing.
Okay.
Commonly EGFR, ALK, ROS, RET, MET,
Hmm.
HER2, PDL1, etc. You can do
Hmm.
the more the so these are all platforms we call. The
Okay.
bigger the platform, the more genes you
More.
check.
Yes.
Okay, it's like how do I tell you? It's like a speaker size.
Okay.
Smaller speaker 100 watts, bigger speaker 500 watts, even bigger. So your TV size, the 25 inch, 49 inch, 65 inch, 85 inch, same way.
70, 80 also.
NGS panel, you can do it for 12 gene panel,
Hmm.
55 gene panel, 160 gene panel, 500 gene panel. But
Okay.
the commonest are still going to be, even if you do 500 genes, most people will still have EGFR positive. So a limited panel is also okay. You don't need to waste your money for an extended panel.
I extend. Yes.
If you are strongly suspicious and the limited panel has come negative, then go for an extended panel. But most patients, limited 12 gene panel is more than enough. You'll pick up something. And once that comes, you start your treatment immediately. It saves money, it saves time.
Yes. So it's like clearly specified. The minimum initially is like a small. Start with small, go for a bigger test kind of
Uh,
a thing. So, doctor, in this like stage 4 lung cancer, is there any new development or a new technology you have experienced or you have seen?
So the biggest thing is first is this specific EGFR AL cross mutations,
Hmm.
immunotherapy. Earlier,
Okay.
there was no concept of immunotherapy, right? So
Yes,
now
yes.
on the tumor, we check for something called PDL1.
Yes.
PDL1 means program death ligand 1.
Okay.
That's
Okay.
again a receptor on the cell. You
Hmm.
check for that. If you are more
Okay.
than 50%, immunotherapy alone is enough and it
Oh.
works very well. If you
Hmm.
are between 1 to 50, it's added with chemotherapy. And the
Okay.
advantage with immunotherapy is you will stop your chemotherapy at some point because chemotherapy
Okay.
has toxicity, side effects, but
Yes, yes,
immunotherapy
yes.
can be continued. So you are suppressing the disease with continuous maintenance treatment.
And also, doctor, like chemotherapy, immunotherapy won't have any major side effects like,
Nothing. No, no
oh,
hair fall, no nausea, no vomiting, none of those. And the advantage is it can be given and mark my words. Those patients who respond generally to immunotherapy have a durable response. That is, their response are longer.
longer. Okay.
So you should hope that this patient responds because that patient will do well for a longer period of time.
Okay. So, doctor, like this immunotherapy word is quite exciting. Can you brief more on what is the role of immunotherapy and
It is a
detail?
medicine which boosts your immunity to kill the cancer cell.
Oh,
So for
okay.
many generations or many hundreds of years, scientists have, see, one of the first uses of immunotherapy has been, I think, the bacterial toxin given to kill infection. Okay.
Yes. Hmm.
So that way, then it has also been used to kill the cancer cells. So that
Okay.
is basically boosting your immunity to kill the cancer cell.
Cancer cell.
It
Okay.
is. It started around 10 years back, routine practice. First started in a disease called melanoma. Recently, I'm talking about the last 10 years, where
Hmm.
these drugs called nivolumab, ipilimumab, pembrolizumab have showed dramatic results in melanoma, which is a skin cancer.
Hmm.
Now it is used in renal cancer, excellent results in kidney cancer, lung cancer,
Oh, wow. Okay.
and you use it in breast cancer, you use it in liver cancer, you use it in stomach and foot pipe cancers, you use it in lymphomas,
Okay.
so urinary bladder cancer, you name it, it is used in that. Cholangiocarcinomas or gallbladder cancers. So head to toe, now you have immunotherapy molecules for every indication.
Oh, wow. So it's
It doesn't work like chemo, no side effects like chemo. Yes, 5% patients can have different side effects like thyroid issues, sometimes lung problems and all that. Can continue as a maintenance, you need not stop it. And in those whom it works long.
wow. So, Dr. Good, with immunotherapy, as you initially told, it's like a normal tablet, what a diabetic or a BP patient, just one pill a day can
No,
work.
immunotherapy is an injection.
Okay,
It's an
okay,
injection. You have to come to the hospital. You come once every 2 weeks or 3 weeks and take the drug and it's a 1 hour injection.
okay. But then also, doctor, with just spending little bit half day a time in a hospital, a patient can lead a normal life,
Correct. The only hitch is,
unlike chemotherapy.
correct, it's expensive. It's still expensive. Despite
Oh,
the support program, today the government offers pembrolizumab. You buy
huh.
5 cycles, the remaining 12 cycles is free. But
Hmm.
still, even those 5 cycles cost few lakhs. So not everybody can afford. Hopefully that will come down.
Yes, yes. Obviously, looking into the development of new technology, I hope, doctor, the immunotherapy cost will also come down. Hoping for the best.
Once generics start flooding the market.
Yes, yes. So, doctor, like for a stage 4 lung cancer patient, what will be like? Can you brief on the prognosis for that?
Just as we discussed. So if you're driver mutation positive, if your disease burden, the amount of
Yes.
disease you have is low, you will
Hmm.
do very, very well. The
Oh,
prognosis
okay.
is beyond 3 years, 5 years now.
That's
And also, there is a set of stage 4 lung cancer patients who have what we say oligometastatic disease.
okay.
That is, imagine I am EGFR positive. I am put on
Hmm.
this drug called osimertinib.
Hmm.
Every 6 months, you scan.
Okay.
Doctor says you're fine. Next 6 months, scan. Doctor says you're fine. Next 6 months. 3 years have gone by. Fourth year, the
Oh,
doctor says your tumor has uh, is the same, but in another area you have a small tumor now.
okay.
What you can do? There are two options. One, change the drug to
Yes.
chemotherapy, or because this is only one area which is resistant,
Hmm.
target it with radiation or maybe even surgery. So
Okay.
oligometastatic means oligo is less,
Hmm.
small, or one or two, few,
Okay.
few
Few.
basically. So in few areas or one area where your disease has increased and other areas it is under control,
Hmm.
try to remove that or give radiation and kill that and continue this drug till it works. Because this drug may work for another 6, 9 months, who knows?
Yes, yes, yes.
Then when it changes, when it progresses, change the drug.
Okay.
One more thing is, so now if you talk about, just to, for the completion sake, when you talk about EGFR positive,
Hmm.
there are drugs I told you. Now it
Yes.
is like your iPhone 10, 12, 14, 16, first
Third
generation
generation.
EGFR, second generation, third generation.
Hmm.
First generation is called erlotinib, geftinib. The
Okay.
latest is osimertinib.
Okay.
So today's indication guideline is you have stage 4 lung cancer,
Hmm.
EGFR positive, go
Hmm.
for osimertinib.
Okay.
But osimertinib is expensive. I cannot afford, for
Yes.
example. Then you
Hmm.
start erlotinib.
Okay. The first generation.
After 2-3 years, suppose, or whenever you progress on erlotinib, repeat a biopsy.
Okay.
Look for another mutation that is called T790M mutation. If you
709.
have that mutation, go for osimertinib. If you don't have, go for chemotherapy.
Oh,
So,
okay.
after erlotinib, if your disease progresses, repeat a biopsy. If you are T790M, it is good. Go for osimertinib, another tablet. If you are negative, go for chemo. 50% will end up with osimertinib, 50% will end up with chemo.
Ayyo,
So
okay.
when a patient comes, you can say there is 50-50 chance you may be positive or negative. ALK. First generation is crizotinib, second is ceritinib, third generation is alectinib, lorlatinib, brigatinib, etc. So
Okay.
start with, if you can afford, the guidelines are alectinib, brigatinib. Otherwise, start with crizo. If you progress, go for ceritinib. Progress, go for alectinib.
Okay.
Another beauty is these third generation drugs, they grow well into the brain. And if there is any cancer in the brain, you don't need radiation. This tablet will go into the brain and suppress that also.
Wow. Okay.
So imagine a patient. So nowadays we are avoiding radiation in many EGFR and ALK positive patients. If they have small disease in the brain, not large disease, but small disease, if they don't have symptoms, because osimertinib and alectinib go into the brain and control the disease. And they also control the disease in the rest of the body. So they are excellent drugs. The safety profile is excellent. They work longer than the first generation, second generation. They go into the brain,
They cross the brain,
the
BBA
brain barrier.
brain marrow. That's
Literally.
really
So those are the advantages of these first generation, third generation, osimertinib or alectinib and brigatinib and ALK positive.
wow. So the newer technology has really given a very good rate or good treatment or a good prognosis for the patient then.
Quality of life is excellent. You can avoid radiation. You can avoid chemotherapy. You are on tablets. You are sitting at home. Literally no side effects. Longer survivals.
And day-to-day life is like they're normally doing as they're doing it before.
You have to see to believe.
Yes. Doctor, actually, there is a question from an audience which we have received. Is there any connection between lung cancer and tuberculosis?
So there have been reports where they say patients who have tuberculosis have a higher risk and all that, some anecdotal reports, but not really. If you have
Okay.
TB, doesn't mean you'll get lung cancer. Nothing like that.
Okay.
The risk is with smoking.
Hmm.
That is why in heavy smokers, especially in the West, they say do low dose CT scan once in 2 years to see if you develop lung cancer.
Okay.
The thing should be stop smoking. Those fellows don't stop. So they say
No.
either, so okay, you smoke, but do low dose CT scan so that if you get lung cancer, we'll pick it up early.
Yeah, at least before ending into stage 4, at least,
Okay,
or stage 2, stage 3, it can be taken
correct,
care.
correct.
Okay. So there is a connection between both of them.
Smoking, obviously, in lung cancer. In smoking, you need to do low dose CT scans, and those who are heavy smokers.
Okay. So, doctor, this was something today we have learned about how exactly a patient prognosis or a life at stage 4 lung cancer, doctor. So, we came to an end of this interesting session to understand how actually the happy is even in the stage 4 lung cancer, there are so many treatment options available with such a good prognosis rate for a patient.
You will
So,
not believe they do really well.
wow,
And all the examples I gave, people going to work, people driving, people being, what do you say, managing in administrative roles, people
wow,
teaching children and school students actively,
wow,
okay, without missing work. These are all our patient stories. And
wow.
their ages range from 40 to 80. So no age is exempt that they are not going to do well. Even if you're old, you're going to do well.
At
And this is
80
not a
years,
death sentence.
yes.
But follow the step-by-step process. Do the molecular markers, do the IHC, and then go ahead.
And also a very special request. Don't ever cross, always consult a doctor because they follow Google and Google guides.
Now, that's the whole point, right? Do a step-by-step job and go ahead and your doctor should be able to guide you.
So thank you, doctor. Thank you very much for your valuable time. Doctor, before closing the session, I will request you to give a message to our audience about the Lung Cancer Awareness Month.
The first message is don't smoke, don't chew tobacco. Second, don't ignore lung cancer in non-smokers.
Hmm.
Three, any chronic cough, any breathlessness which you have, any pneumonia which is not improving,
Hmm.
consult an oncologist. Maybe they need to scan you to see if you have something in the lung. If it is still there, early stages are operable. Advanced stages still have options in the form of driver mutation positive lung cancers or chemo or immunotherapy. So the bottom line is you're going to do well, but stay away from smoking, stay away from secondhand smoke, stay away from polluted areas if possible, wear a mask, be careful, and spread the message to others not to smoke.
So a small request will be you also don't smoke. If you find someone smoking, please ask them or request to stop smoking or quit smoking.
Perfect.
Thank you, doctor. Thank you very much. Thank you, everybody, for being a part of this Lung Cancer Awareness Month. And from Cancer Reach, there is a message of wishing all strength, hope, and good health. Thank you, everybody. Thanks a lot. Thank you, doctor.
Thank
Thank
you
you
so
very
much.
much.